Hello, good evening, everybody. Welcome to the webinar series that we are ongoing series called the Health and Wellness series. And today, from Namma Bengaluru Foundation and also from Manipal Hospital, we have Dr. Srinivas K, who's a consultant in the ENT department. He heads the head and neck surgery department. And Dr. Srinivas is at the Manipal Hospital, Millers Road. You can always visit Millers Road for all your ENT issues, and doctor would be happy to welcome you and also treat you. A brief about the doctor today is doctor is from Jawaharlal Nehru Medical College from Belgaum. He actually graduated in the year 2008 and MBBS from Devraj Aras Medical College in the year 2004. His specializations is ENT. He has vast experience in ENT consultancy, surgeries, emergencies, and in micro-ear surgeries. He is also a specialist in functional endoscopic sinus surgeries, voice surgeries, surgeries for snoring and sleep apnea, head and neck, benign and cancer surgeries, rhinoplasty, otoplasty, and pediatric ENT also. So doctor is a well-known and renowned doctor, and he has many certificates and presentations to his credit. And today we welcome Dr. Srinivas K to our webinar series Health and Wellness from Namma Bengaluru Foundation. And I hope it would be a great session for all of us. We will have the doctor speak to us first. And as usual, you can raise your hand or put your questions in the comment box. And after doctor's brief presentation and on the topic of hearing loss, we will open the floor for questions, and then you can ask the questions to doctor. Welcome, doctor. Welcome, everybody. And please, doctor, if you can take it up. Thank you.
Thank you very much, sir. I really appreciate Mr. Vinod Jacob for having to host such kind of a scenario. He's the founder of the Namma Bengaluru Foundation. Very happy to know that. And he's doing such kind of great activities which are really helpful for us. Thank you very much, sir. I would like to thank all the audience who are also here to listen to the small topic. So I chose on hearing loss because of late I've noticed that hearing loss has been a great important concern in our society. That's the reason why I thought let's talk about hearing loss. Okay, I'll just go ahead and share my screen, which has a presentation on the hearing loss. So this is the presentation on hearing loss. Okay, what is hearing loss? Hearing loss is when an individual is unable to hear a normal conversation with kind of a hearing loss. There are many different kinds of hearing losses an individual can experience. Yeah. First, let's go to how an individual will hear. So this is the diagrammatic representation of our ear. When sound is spoken by anybody, how do we hear that? The sound waves come along, they enter the external acoustic meatus, and once the sound enters here, it goes and vibrates the tympanic membrane. The vibration of the tympanic membrane is then transmitted by way of three bones called as malleus, incus, stapes, which are the smallest bones in the body. They not only transmit the sound, they also amplify that sound and transmit it into the inner ear. This is called the inner ear, which has the cochlea and the vestibule. The cochlea is the one which is primarily helpful in hearing. It has certain kind of organs called as organ of Corti or hair cells, which when this mobility causes a motion of liquid in this, that liquid motion causes the hair cells to depolarize. That is depolarizing, meaning to generate some amount of electricity which passes through this nerves and then reaches the brain. That's how we hear sound. How can a hearing loss develop? A hearing loss can develop with a deformity in any of these areas. The most commonest form of hearing loss in any individual in any age group would be accumulation of wax in this ear, in this area. Just to give an example how. So you'll have little wax which gets collected or dirt which gets collected. So when that happens, the sound cannot enter the tympanic membrane, and that can cause some amount of hearing loss. So let us go to the different types of hearing loss. So there are three different types of hearing loss. One is called conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. So what is conductive hearing loss? Conductive hearing loss is the sound which is spoken by an individual is not conducted to the inner ear. Why is it not conducted? For example, as first thing, as I said, is okay, you have some wax. The wax is blocking the sound from going into the tympanic membrane, and that causes a hearing loss. The second thing, the most important structure is the tympanic membrane. Tympanic membrane is nothing but a small paper thin structure, a radius of 5 to 6 millimeters. This tympanic membrane vibrates like a speaker cone. When we see the speaker cone, it's vibrating, but the speaker vibrating generates sound, whereas our tympanic membrane, it takes the vibration of that sound and then further sends it behind. If there is a hole in that tympanic membrane, definitely it cannot vibrate. The vibrating capacity of that tympanic membrane comes down. When that happens, that the sound what is spoken 100% will not be transmitted. Only a few percentage of that sound will be transmitted depending on the size of the hole in the tympanic membrane. The other, that is called as safe disease, where we can see in this diagram, the whole round structure is the tympanic membrane. This is the hole or the perforation in the tympanic membrane. There is a second type of conductive hearing loss called as unsafe disease. Here what happens is, in these individuals, there is a small growth of the skin inward, which is called as cholesteatoma, which grows inward, and this prevents the conduction of the sound. This is another type of conductive hearing loss. Let's go to the next type of hearing loss. Okay, this is one of the most commonest kind of hearing loss. This is called as serous otitis media or glue ear. Why does this happen? I think all of us are aware, when we go in the flight, we try to equalize pressure between the nose and the ears. So how do we do this is, we try to close our nose and blow some air. When we do this, the air from the nose goes via the Eustachian tube. Eustachian tube is nothing but a small tube which connects the nose to the ears. God has given us this mechanism wherein the pressure from the outside and the inner ear, the body, should be equalized, and the Eustachian tube does that. In people who have severe allergies, severe cold, or who have traveled without equalizing their pressure, there is a chance that that cold which was in the nose has got transmitted via the Eustachian tube into the middle ear. I hope you all understood what is the middle ear. The middle ear is the space between the tympanic membrane and the inner ear. So once this liquid gets accumulated, you can see this, there are air bubbles here. There you can see 2-3 air bubbles, and there is liquid here. All this is liquid. So this is the cold which an individual had, which was pushed from the Eustachian tube from the nose into the ears. When you have liquid like this, this inhibits the mobility of the tympanic membrane. The tympanic membrane does not move freely. When the tympanic membrane does not move freely, the sound will not get conducted into the inner ear. Unless the cone of the speaker moves, sound is not produced. The same way, unless the cone of the tympanic membrane moves, the sound is not transmitted inside. So this is the most commonest thing. This is seen very common in children who have frequent allergies, who have ear infections, or people who have enlarged adenoids. Adenoids are small structures which are present in children, which are present near the Eustachian tube. They block the Eustachian tube, and that can lead to some amount of hearing loss. This is a very easily treatable condition with few medications and nasal sprays. 90% of the patients become 100% normal in their hearing. Whereas if you go to the previous things, what I just spoke about, the unsafe and safe kind of hearing loss, where there is a hole in the tympanic membrane or where there is a development of a cholesteatoma, that would need surgical intervention by ENT surgeons. Let's go to the next. So this is another very common thing which we notice of late. It's because of the usage of earbuds. People are using I was using the earbuds. My child came and hit my hand, and I went and made a hole in the tympanic membrane. This is called a traumatic perforation. Traumatic means it happened secondary due to a trauma by either putting some pen or pencil, or could be the earbud, any by mistake it happens. In this case, what happens is there is a hole which is created in the tympanic membrane. This hole behaves like the safe disease, where the tympanic membrane mobility comes down. You need a complete closure of the tympanic membrane for the sound, for the tympanic membrane to move freely and conduct the sound. When there is a hole, the mobility of the tympanic membrane comes down, and that prevents the mobility of the tympanic membrane. This is a very simple condition. All we need to do is protect your ears. Don't let water go inside. Might be avoid swimming, diving, or any kind of water sports for a month or two until the hole heals. Usually we give some antihistamine medications, and if there is an infection, introduce some antibiotics, things like that, and ask the patient to keep the ears dry by not letting water go inside even during a head shower. This will 99% of the time heal the traumatic perforation. By literature, it is said that 95% of all traumatic perforations heal without any kind of surgical intervention. So that's a good thing, but let's not have a perforation. But if you have, it's nothing to be get worried of. The other most commonest kind of hearing loss, what we see in young adults, especially within the age group of 20 to 40 years, is the small issue called as otosclerosis. What is otosclerosis? Otosclerosis is nothing but the deposition of calcium bone. You see this? These are the three bones as I explained. So the tympanic membrane moves, then you have the malleus bone moving, then you have the incus bone which moves, and then you have the stapes bone which moves like that, like a piston. But when this piston to move, you need a free bone. In certain individuals, there is a calcium deposition which happens between this bone and the outer bone, and the piston kind of motion which this bone is supposed to do is inhibited, by which you see all this is working well. All this tympanic membrane is moving well, this malleus is moving well, incus is moving well, but stapes is got stuck. It does not move. This is a very common sign which we see, especially in patients who have lived along the coast or who have had high fluoride exposure during their childhood. And it has a genetic predisposition also. In this, what we do is a simple surgical procedure. We go through the canal, lift this tympanic membrane, go here, make a small drill in this stapes bone, remove the suprastructure, and put a piston from here to here. And this restores their hearing to 100% normalcy within a matter of few minutes of the surgery. So this is one of a very satisfying surgery where we give back the patient 100% hearing, and that within the few minutes of doing the surgery. The biggest worrisome factor in Bangalore or any metropolitan city is the noise-induced hearing loss. What is noise-induced hearing loss? We have two kinds of noise-induced hearing loss. One is sudden onset noise-induced hearing loss. Sudden onset is seen after an exposure to a sudden sound burst of more than 140 decibels of sound. This is most commonly seen in a grenade or in any kind of industrial mishap or any kind of a music mishap, or somebody went to a near speaker and stood and suddenly there was a sudden burst of sound. This is one of the most troublesome things which could have been prevented, but people have got affected. So in this is one thing. The other kind of noise-induced hearing loss is a chronic noise-induced hearing loss. What is that chronic noise-induced hearing loss? If a person is exposed to a decibels of 120 plus every day for more than 4 to 6 hours without any protection to his ears, that is called as a chronic noise abuse, and which can lead to definite some amount of hearing loss. These are the ones which can be prevented. You need not be exposed to such kind of loud noises for an exposure which is beyond 3 to 4 hours of time. Majority of the things what we have noticed are, we have seen them in might be our bus drivers or auto drivers who are especially stuck in traffic signals and exposed to such high sounds of noise. I have actually interacted with many of these individuals and explained to them the importance of might be, if they are going through a tough time, use some cotton for some time and then remove the cotton and things like that, which has helped a few of them. The other thing what we can see in the airport, we have a lot of stuff. Vikram Hospital or Manipal Hospital, Millers Road, is tied up with the Bangalore International Airport for all their health checkups and everything. With so much of awareness that a flight or a jet can produce more than 140 decibels, Still, people are not wearing protective gear. That's so sad that we re-educate them and try to tell them wearing protective gear is extremely important in industries and in people who are working in noisy areas like the airport, who are the ground force. The other thing is honking. Honking is such a bad thing. You can see a honk can produce not less than 120 decibels of sound. So let us make a conscious effort to use less of the horn. And even if you're using a horn, kindly don't upgrade your horns to something else. Let us stick to the industry standard BS6 horns, which are government approved to be used in all our vehicles. If a Maruti Suzuki or a Toyota or a Mercedes is giving a horn, let's be happy with it. Let's not upgrade the horn. Upgrading the horn is really a bad thing, which I think we have to seriously talk to the government officials, and they should stop upgrading horns, which is not the right way to drive. You're not important. Everybody in the road is important. You're not the only one driving. So let us look at not upgrading our horns. That is something which, when I discuss, when I have the police commissioner or some of the big people who come to me, I talk to them, tell them, sir, why do you allow the upgrading of horns? And they say, yes, we don't allow that, but they're doing it and we have no way how we can monitor such kind of things. But I think they should bring in a system where a horn fitted should have a BIS 6 compliance in noise pollution. Something like that, which we should all look at. I think sir would be a best person to give us ideas how to go about doing this. Okay, this is one thing which is preventable. Let's prevent hearing loss. Let's stop noise-induced hearing loss. Let's go to the next one. This is another extremely, very, very, what we call the most dangerous thing which is happening of late. Initially, if you see in the 1990s or in the early 2000s, sudden sensory neural hearing loss is a very rare entity. Of late, it's a very common entity. At least we see daily 1 or 2 patients who come to us with a sudden sensory neural hearing loss. This is where an individual loses his hearing all of a sudden. He finds that, okay, I was listening to earphones and I see that suddenly my right ear hearing has gone down, and he comes to us. This could happen because of various factors, but we feel the most important factor has been stress, and the other important factor has been noise abuse or sound abuse. Both are preventable. How I can say stress is preventable is a big question, but let's not get into that. This is a condition which, if treated within the first 24 hours, brings back the hearing to 100% normalcy. So let us look at this graph. When we look at this graph, the upper line is the normal hearing range. Whereas when you see the lower graph, this is the hearing range where an individual has experienced a sudden sensory neural hearing loss. We have had thousands of patients who have come to us on the day 1 or within the first week or maximum in the first month. We have given injections directly into the ears. We have given them tablets and they have recovered their hearing 100% normal. We have had cases where we haven't recovered also, but that's a very small percentage when compared to the success stories of the people who have, recovered very well. So this is something which we would like to, educate people on. There is a concept called sudden sensory neural hearing loss, where an individual loses his hearing suddenly. In case this happens, kindly visit the doctor at the earliest. The earlier you reach a doctor, the 100% recover in the hearing. The later you reach, if patients come to us, 3 months back, I lost this hearing. Whatever treatment I give, definitely you're not going to recover 100%. There's only a percentage chance of you recovering a small percentage of your hearing. So kindly, this is something which is very, very important. We have educated our doctor fraternity about this. This is a concept where till even 2008, 2010, we were not treating this disorder. But there was a revolutionary article which was published, and that article said giving intratympanic injection dexamethasone can revive hearing. And there are now, from then to now, thousands of studies done on this, and all have given us great results on this. So let us identify, treat this. Let's not leave this. The next, oh my God, this is something I hope all of us, we should not experience it, but majority of us might experience this in our lifetime. This is nothing but age-related. Age-related, every organ becomes weak. Same way, the inner ear has hair cells which start dying out slowly. They become weak, and this can create a hearing loss. This hearing loss needs proper assessment, identifying what is the hearing loss, and this is called presbyacusis, where age is the only thing, the reason for the hearing loss. To be factful, there is no treatment as such to treat this. The only treatment to this is to start using hearing aids. We can see here we have given this elderly gentleman a hearing aid, and this is the best way to treat this. Why hearing aid? 2-3 reasons. If you have a profound hearing loss meaning really very bad hearing loss, that is a risk to yourself. So it is a risk to yourself, meaning you're walking on the road, you can't hear a honking sound. Somebody is ringing the doorbell, you can't hear that. Somebody is calling for a help, you can't hear that. That comes as a profound hearing loss, and such individuals must wear a hearing aid. The individuals who are in the moderate range, it is their choice. They can wear one, they can skip one. We would not really force anybody, but people in the extremes, kindly wear a hearing aid. There's nothing wrong in wearing a hearing aid. You could save yourself, you could save others by wearing a hearing aid. The other things are the congenital hearing loss. This is something very difficult for a young parent to understand. Congenital hearing loss is where a child is born without hearing. There is absence of hearing during birth itself. This can be because of multiple reasons. There are multiple risk factors involved in this. You have the infections, the parental infections like herpes, toxoplasmosis, cytomegaloviruses, rubella. Smoking and things are not a real common factor in Indian population, but this a bigger issue in the West. Diabetes, maternal hypertension, unidentified, not treated, birth asphyxia, birth trauma, multiple causes. How do we identify this? If a child is not responding to the mother, if a child is not responding or looking at the mother, that is the most easiest way to identify. Of late, we have introduced neonatal screening program. What is a neonatal screening program is we do this test called otoacoustic emission test, where as soon as a child is born, there is an audiologist who goes to the child, keeps a small machine in the ear and listens to the sound whether the child can hear or not. This is an excellent screening test which hardly takes 10 minutes, and we get a in-depth analysis whether the child can hear or not. This is introduced in majority of the hospitals. Even our Karnataka government has introduced it in the government hospitals. So the introduction of the neonatal screening has really helped us to identify neonatal hearing loss. Neonatal means childhood hearing loss. And this kind of a hearing loss, the only option we have is a cochlear implant surgery or using a hearing aid. As per the Karnataka government guidelines, every child who is born with a hearing loss should be identified and should be given a hearing aid for at least a 6 months period of time. And only then we look at going in for any other further treatments like cochlear implant surgery. In Vikram, Manipal, we have done a lot of cochlear implant surgeries with an excellent success rate. I don't think we have had anybody who has had a failure in this kind of a surgery. We have not had a single failure on this. Fantastic results, early identification, early surgery. Why early surgery? A patient or a child can talk what he hears. If a child can't talk, means he's not hearing. Kindly go check. A child can learn to talk only within 6 years of age. If you can't identify a child's hearing loss within 6 years of age, the child has lost the capabilities of talking. So let us identify by 2 to 3 years. Majority of our surgeries in Vikram we have done in Manipal has been less than 3 years of age. Very rarely we have done 1 or 2 at 4 years of age, but majority of the children have been at between 3 to 4 years, not beyond 4 years. Thank you. These are the small things I thought we would share upon. I think we are on the chat here. We have many of, let me look at the chat.
That's great. I think, it was very, very useful. I think, among the 5 elements of, like sight, touch, hearing, smell, and taste, a lot of people don't take hearing as a important, issue unless they can't taste their food or see properly. But they don't take this, ear and hearing as a very, very important issue, because it is, I think, the most important, effect of touch that or feeling that we need to actually learn a lot of things. I think there are a lot of people here. Anybody who would like to ask doctor a question can raise their hands or even type their questions, and then we can take it up. As doctor rightly pointed out, I'd like to take up that honking issue, doctor, where we are taking it up from Namma Foundation, and especially near schools and hospitals, where there is a no honking zone, but people use their horns, which is really sad. It goes beyond human proposition or intelligence that people can use near a hospital where patients are sick and in schools where children are supposed to study. And I have spoken to, in fact, the Traffic Commissioner, Dr. Ravikanta Gowda. We had these sessions. I think BMRCL has taken it up, and all the metro stations are a no honking zone. Again, because of the fact that it's a covered area, and when you honk there, it echoes even worse. The decibels even increase.
True, sir. Very true.
Yeah. So we've been doing these sort of campaigns across and Bangalore, and also have told them not to use their horns, because as you rightly pointed out, doctor, it is more than 120 to 140 decibels. And as it is, there is a street noise when you drive a vehicle, because the vehicle has an engine and there is an engine noise. And also, when we found these autos, we were using these wrong silencers. And some of the luggage autos, which are very high noise oriented engines, these are issues that happen. So can we open the house to questions? So we are open, and I think we can take in the questions, or we can type in the chat box. Do we have any questions in the chat box for doctor?
Excellent, Mr. Somshekhar. Thank you for the question. Tinnitus is nothing but a sound, a hissing sound, which is heard tinnitus, a hissing sound can be generated from many areas. The most commonest is the inner ear. The ear has a property to generate sound. That is called otoacoustic emission. In a newborn screening, what do we test is we put a microphone and see whether the newborn baby's ear is emitting sound. If the newborn's baby ear is emitting sound, that means the baby can hear in the future. So this sound is there inherent with us since we are a child. But fortunately, because of our capabilities of hearing outside sound has been very good, we do not hear that sound. Now, once we lose the capability of hearing outside sound by a few decibels, that is because of any hearing loss or any kind of thing, any of the hearing losses as I explained, we start to hear that hissing sound. So the hissing sound says that there is some issue happening in the inner ear. I'm saying the most common. There are other reasons. I'll come to them later. So in such an event, if you attend to your doctor at the earliest, he could identify what is the cause of the tinnitus and definitely rectify it. The second thing which we have noticed tinnitus has been because of the temporomandibular joint, habit of chewing food one side. The other thing is accumulation of wax in the ear. The other most common thing, fungus in the ear. Fungus is something which can produce high amount of tinnitus and which is 100% treatable. So not all tinnitus is not treatable. Only a few fraction of the tinnitus is not treatable, whereas 95% of the tinnitus, if identified on time, are very well treatable, and I don't think we should worry much about it.
Thank you, doctor. I think there's another question from Maya.
Yes.
Maya, does cleaning wax using earbuds cause hearing loss?
No. See, there are two types of waxes. Let's get to the kind of waxes. So you have wet wax, dry wax. Dry wax is the wax which is just around the rim of the ear, external auditory canal. Whereas wet wax is which is like a bleb or a ball which is present in the ear. Patients who use earbuds who have dry wax, they bring out the wax. It is not at all a problem. But patients or individuals or a genetic predisposition to have wet wax will push the wax in. And when you push the wax in, that can block your ear and cause some amount of hearing loss. And that is treatable. All you need to do is go to the doctor and get that wax removed. You should be able to hear very well. So the people who are using earbuds, they know whether it is wet or dry. If an individual has wet wax, he will never use never use a earbud. He would definitely visit the doctor. Patients who have dry wax are permitted to use the earbuds, but the only problem we see in the younger generation is a earbud is like a feather. You need to use it like a feather touch, not take it and rub it and spoil and damage the ear. That's one sincere thing I would like to tell. Kindly treat the ear. It's like a baby. Treat it like a baby. It will never trouble you in your life. Mr. Sanguni is asked another question. Reasons for vertigo.
Yeah.
There are multiple reasons for vertigo. The most commonest reason is if we go to the ear has the balancing organ, as we are aware, as I said, the balance organ. So we have the cochlea, which consists of 3 semicircular canals, and the vestibule, which has the cochlea and vestibule, which has the 3 semicircular canals and the balancing organs. So there are reasons which vertigo can happen. Is first most commonest is the benign positional paroxysmal vertigo.
Doctor, we lost you for a minute. Yeah.
No, sir. I thought I'll go for the slide so that I can explain them in a better way.
When you were talking, we lost you for about I think 10 seconds.
Okay. Can I go ahead now, sir? Am I audible?
Yeah, you're audible.
Yeah. So when you look at the ear has cochlea, which is the organ of hearing. You have the vestibule, which is the organ of balance. You have 1, 2, 3 semicircular canals, and you have 2 more objects here, which are there for balance. So there are calcium particles which are present here called as otoconia. When these calcium particles move from this area into any of these canals, that is one of the most commonest reason to cause vertigo. The other commonest reason is this ear swells up because of increased pressure, and that can cause vertigo. The other more common reason is this nerve, what you see, this nerve can get infected. That's called vestibular neuronitis. That can cause vertigo. The other common reason is this area can get infected. That's called labyrinthitis. That also can cause vertigo. So there are multiple reasons why vertigo can happen. Vertigo itself is a very extensive topic which would require a lot of time to discuss on. But yes, the biggest culprit for vertigo is the small 3 semicircular canals, which by volume are less than 5, not even 0.5 micrograms, and they can trouble us. I'll stop the share, sir.
Yeah, it's okay.
No, sir. I thought I'll just show them that, so it would make it a little easy for us to understand.
Understand exactly. Yes. What are the other earbuds that you recommend, doctor? Somebody is asking. Vinita?
Sir, definitely, I wouldn't recommend Johnson earbuds. Johnson earbuds are so hard. I don't know how Johnson, being such a great company, makes such hard buds. I would definitely say no Johnson earbuds. Yeah. You get multiple companies called Tulips and so many things which are really soft, sir. So It should be the olden days. They used to use feather. I think we should have feather earbuds someday. That would be the ideal things to clean. So yeah, that is the thing. Something soft and smooth would be the ideal earbuds. Kindly don't use the Johnsons. They're extremely hard. Somehow I should write a mail to them, might be.
Yes.
Yes, sir. Somebody has some question. Good evening, doctor. Desk clean. No. Sangunis, I finished. Vertigo. Would you recommend 2 years earbud? Dry wax once in a way, might be monthly once. You could use earbuds. People who have dry wax, that shouldn't be a harm. But the most important thing is the ear is like a baby. Be gentle. Don't try to be harsh with the ear. If you're harsh with the ear, it will trouble you.
Yes, doctor. Also, doctor, for people who are working in these industries, I was just thinking because, a lot of people, including my father, was working in the aeronautical industry. Mm-hmm. And they are prone to a lot of sound, and the ambience sound itself is very high. So what do you recommend them to wear? Is because, in abroad, the US and UK, maybe they are provided with safety gear, which is for the ear. We only talk about helmets for the architect or civil engineer, and we talk about boots for the people working in the iron or gloves. But for the ear, nobody is recommending anything. So I just wanted to check with you. What do you recommend? Should they need to wear some earplugs?
Yeah, we definitely have these protective gear which are available commercially. If you look at Bangalore International Airport, this is one of the airport which is very much compliant with noise pollution protection to their staff, sir. They come on annual checkup. So we meet them regularly, and with all of them, they wear these protective gears. You can see the headphones which they wear, like huge yellow color ones.
Yeah.
So they are provided. Majority of them, every major industry which is ISI compliant or which has any of the compliance have these protective gear. And every individual is aware, but they don't use it, sir. It is a personal choice where they fail to use it, and they are the ones who are getting into trouble. It is not that it is not provided. It is a very wrong notion that it's not provided. It is definitely available. It is being given to them, and they have been educated about it. But their carelessness is what I see is troubling the things. So now what the government has come up with is they have a yearly checkup in industries where sound is more. They have a yearly audiometry test which is done. So because of this yearly audiometry test, now they are gaining awareness that they need to protect their ears. So the awareness is this new rule which was introduced, I think, I don't know when, in the 2005 or somewhere, they introduced that every year annual audiometry test for people working with machinery. This test has definitely benefited the individuals, and they are wearing. So I feel that this is more in the the smaller industries, sir. The small scale industries is where we need to bring the awareness. Whereas the bigger industries, definitely the awareness is there. The gear is available, just that they need to use it, sir.
Yes, doctor. I think we have a question from Asha. So she's asking how to use the earbuds carefully and the symptoms of ear loss and how to prevent it. How long can you listen to music?
If you're listening to music at low volumes, you can listen throughout the day, never a problem. We would recommend listening to music from external speakers. The first best choice, use simple speakers from outside. Do not use earphones or earbuds to listen to music for more than 45 minutes in a single stretch. That's really not nice. Even if you're working 45 minutes to an hour, give it a break of 10 minutes and then go back to the things. If you're working, if you're a professional worker where it demands to use headphones and earphones, definitely prefer the headphones more than the earphones. Try to avoid in the canal earphones. You have in the canal earphones which the earbuds go completely into the ear. We would recommend not to use such kind of things. The best is to use a Bluetooth speaker or a normal age-old speaker. Second best is the headphones, and the least of choice are the earphones, and the worst of them is the in the canal earphones. Listening to simple light music even throughout the day, never an issue at all. It is listening to more than 110 decibels or 90 decibels using hi-fi gadgets, trying to increase the volume to the max. Those are the issues which cause a lot of issues. We had a lot of DJs who come to us with these issues. We train them, tell them, but they say, no, sir, I can't do that. I have to use my headphones. But it's their professional hazard. But as a normal general population, I don't think we need to be like them. We can stay away from them. That would be really helpful. Using earbuds carefully is, you see, children are not around when you're using earbuds. Don't teach your children how to use earbuds and toothpicks. These are the two major injuries which I as an ENT see in my children who come to us. My dad, I saw using a earbud and now I'm using, and they come with ear pain and all infections. So kindly keep earbuds and toothpicks away from children. Don't use earbuds and toothpicks in front of children. If you want to clean your child's ear, please take the earbud, use it and throw it away. Don't see to that the child has an access to such kind of things. Be gentle. Be gentle is a soft touch. That's all. Don't rub the ear canal with the earbuds. Softly use them. That should be fine. Also, symptoms of hearing loss. All of us have earphones. Just put your earphones in both the ears. You find that there is a decreased hearing. Yes, you have decreased hearing. I have so many patients who have just come to me by just using the earphones to identify their hearing loss. With the inventions of phone now, it's very easy to identify hearing loss. You will know the moment you're hearing less on the phone, you will know I'm hearing less and run to us. So it's not like before where hearing was not important. Right now, hearing is very important. So people come to us very fast with identification of hearing loss. So I think I have answered majority of
questions. One more question in the same thing, doctor. I was just thinking about these children playing games, because that is what is actually addicting them for more than 45 minutes, as you said. There are children in the gaming zones who are playing for more than 1.5 hours, 2 hours on their PUBG and various games.
Definitely discouraged, sir. Yeah. There is no second thought about it. It's not only about the hearing loss, it's about the eye, the mind, it's about the stress to the body. Gaming children have come to us with bruxism. People who play so much of gaming come with grinding of their teeth. Bruxism is grinding of their teeth. Parents come to me, sir, my child is only grinding his teeth whole night. You get the history, he's been playing games, watching TV. And even if you want to play games, don't give earphones. Why do you want to give earphones, headphones to your children? Kindly don't give earphones, headphones unless they're attending a class or really something important. Otherwise, use the laptop speakers or buy a speaker, a Bluetooth speaker. Don't use headphones, earphones. I mean, that would be my sincere request. And gaming is something we should have a limit on every child's gaming time. We can't deny them their right to play. This is the era. We can't say, no, you can't play. No, let us live in the modern times. Now, gaming is a part of their lifestyle. We cannot remove gaming from their life. All their friends are gaming. And you say, no, you don't play. You don't want an odd child. You want a common child. So please play the game. But I give you a specified time. I'll give you 45 minutes to an hour. Play for 1 hour, enjoy 45 minutes, whatever, and come back home. No more than that. And as rightly sir said, let's encourage playgrounds. Let's push them out. Children never came back home. Our children are not leaving the house. So I think we somehow should put them back. Yeah, that's...
Yeah, I think we have one more same thing. I think Vinita is asking that how long are you recommending for online classes? Because most of the students now, the children are on online classes. So how long can they use the earphone in their classes?
Sir, as I said, if they're using at low volumes, even throughout the day, if they're using, they should not be an issue. Especially children, I would not recommend headphones, earphones. The speaker on the laptop is the ideal scenario. If not the ideal scenario, at least headphones. Avoid earphones. Don't encourage earphones. And if you're buying headphones, kindly buy the best quality ones. Try not to go with the lower standard headphones. And try to give them a break every 45 minutes is the ideal time, what we say, for the eyes and for the ears. 45 minutes of continuous usage and a break for 5 minutes and then repeat use would be ideal scenario, sir.
Yes. Thank you, doctor. I think that was very the thing. I think we have also completed number of questions. Anybody else with any questions can always ask. Doctor is here, and actually we are very much in time. I think there's another not many questions, doctor. So I think it was a very, very interesting and insightful session, and I think the presentation itself spoke a lot, and I think you gave a lot of feedback and a lot of suggestions that we need to carry out now in our personal lives. And do we have any other questions, please?
Thank you very much, sir, for giving me the opportunity.
Sure.
I would like to thank all the audience who are here for sparing their evening time on this thing. Thank you.
Thank you, doctor, very much. And thank you all for joining us today. I think you can visit doctor. Please visit Manipal Hospital, the old Vikram Hospital, Millers Road, because I think Manipal as a chain has actually now expanded their operations and they have actually taken over Vikram. And please do visit doctor when you have any of your hearing issues. And I think, and all the suggestions that doctor gave is something fruitful for us and also our children. And we need to take care of our ears very, very carefully. Thank you so much, doctor.
Thank you, sir. Have a great evening, sir. Bye, sir.
Thank you so much. Thank you. Bye-bye.